Welcome to our presentation on how to develop target travel behavior change campaigns. As my colleague Gaupp-Berghausen already mentioned, each switch campaign consists of 4 key components: the use of personalized consultancy, the use of health arguments, the use of ICT solutions applied to people in a so-called life change moment. And this is important to integrate into a switch campaign by the design of a personalized approach, by organizing customized information material, and by the provision of personalized advice on active mobility, so that people receive the knowledge and opportunity of active travel and are hopefully finally encouraged to walk and cycle more often instead of using a motorized vehicle. To get in contact with target people, 2 different ways are in general possible. The easier one is if contact data of people is already available. In this case, target persons are contacted using a 2-step approach. First, they will receive a letter, a so-called announcement letter from the local switch team with information on the switch project and on the local switch campaign, and this letter requests participation. Second, after they receive this letter, a local call center calls them and tries to motivate them to participate. However, if no contact data of people in a life change moment is available, for example due to data protection reason, much more effort is necessary to reach a sufficient amount of people. In this case, it is very supportive to have local partners who support you, for instance by distributing information on the switch project via their communication channels, but also to announce the switch campaign via articles or via social media. And it is helpful to distribute so-called registration postcards with information on how interested people can take part in switch. As people in this case has to get in contact with the local switch team, it is very important to offer them a variety and very easy communication channels. The registration postcard distributed in Vienna, for instance, offered different ways of communication, like interested people could return the postcard with their contact data free of charge. They could also send a text message, call the hotline number, or they could register directly on our website by using the provided link or QR code. But to make people interested in the campaign, it is very important to find very good arguments, like highlighting the positive aspects of participating in the campaign, or by mentioning a raffle or other fun and gaming aspects. After reaching a sufficient amount of people, it is important to motivate and maintain them by providing customized information. For this, it is highly effective to provide a so-called service sheet, which provides a variety of different brochures, maps, and informations on ICTs, addressing all aspects of active mobility. And interested people can choose all kinds of information they are interested in. To thank for their participation, but also to increase the willingness to participate, also one of several small gifts can be selected on the so-called service sheet, and this incentive should have a thematic relation with active mobility, like pedometers, bike saddle covers, shoe horns, but also different vouchers like on bike repair. In addition, personalized consultancy material can also be used to highlight the positive aspects of active mobility from an individual point of view. Here you can see examples of Donostia San Sebastian in Vienna. They provided so-called Ptp Plans. And these plans can include a comparison of trip expenses, travel times, health aspects, and environmental effects of different modes for specific routes. And here the car trips are compared to the situation where the same trip is either made by public transport, by walking, by cycling, or by a combination of public transport and active mobility. After the selection of information material, information bundles will be composed for each participant separately, and if possible, these information packages should be delivered by switch staff directly to the house of the people, because this provides the opportunity to bespoke the requested information, especially different ICT tools, and also to show participants that their active mobility is one of the project's major concerns. For motivating purposes, it is also very useful to offer so-called supplementary motivational measures in form of side events, like Ptp talks, bike repair workshops, or different theme walks. Now I would like to hand over to Veronica.
Thank you very much, Mailin. I'm going to pick up on some of the things in William's talk, because I'm going to talk again a little bit about ICT tools and health arguments, but I'll keep it brief. And I want to explain really the lessons that we've learned in the last 2 years from some of the campaigns. Again, a lot of this will be picked up in the individual cities' presentations, so it's very much a technical overview of how we've used it. And as William mentioned, wearables are one of the things that we've looked at, and I know a lot of the follower cities are looking at these in their implementation scenarios. And I hope one thing that we have learned, and we will be seeing in future campaigns, is that these things don't really work in isolation. They sit within a broader campaign alongside the personalised travel and planning approach, or alongside some other extrinsic motivation, whether that's a social element or some kind of game as well. Websites, again, we've touched on this before, but having challenges on a website can be a very effective way. They work particularly well when there's an element of sociability, so when they're linked to a social media element, or where people can see that they're competing against another social group that they relate to. So again, thinking about all of these things as part of a package, as a tool to enable behaviour change, but not in isolation. I think that's something that we've certainly learnt. Most of these tools are good at measuring things, at telling you how far you've walked, how many calories you've burned, and those kind of measurables. But actually, the simpler, the better. And the evidence seems to suggest that very simple things like step counting from pedometers can be as effective as some of the more complex tools, especially when we're talking about engaging people who aren't currently active. Those more complex, sophisticated tools are very good for people who are already interested in their own health and want to challenge themselves a bit more, but don't expect them to change behaviour of the least active. So gamification is an aspect that we felt was really important because it brings in this sociability element. And that's really the principles behind the Beat the Street project. And you will be hearing the results from Hounslow and Gdansk of their projects in using Beat the Street. But essentially what we've done with Beat the Street is make the tool very accessible. And we have got children as young as 2 years old playing this game, and grandparents in their 90s. And what it consists of is a box, a sensor in a box that we position on lampposts or on street furniture, and then we recruit children and other community members by giving them a card, an RFID card that they tap on the box that records their journeys. The recruitment in Beat the Street has been really important, and we've had very, very high numbers of participants because we're able to recruit whole schools, and they in turn recruit their parents and other community members. And essentially what we're doing is turning the whole town into a playground, positioning these boxes about half a kilometre apart at key destinations, at schools, along the routes to schools. And we've really captured people's imagination with this idea of turning the environment into a playground for children, but also for adults. And typically we'll have about 50% children and 50% adults taking part. We produce maps, and in this high-tech age, maps are still incredibly popular. And in fact, you'll see from a lot of the campaigns that one of the most requested items is the paper map. And you'll see on this map attached the approximate location of those beat boxes across the city. They're not always exactly half a kilometre apart. Sometimes it doesn't make sense to have them that far apart. They need to be closer because we understand people's footfall patterns. But the aim really is to engage people, to get people to think about active travel in a fun way, to decrease the health inequalities, so making it accessible to everybody, even people who can't afford the high-tech equipment, and bringing communities together. As William said, it's about the social element of this project. The boxes, incidentally, are battery operated. They fit on and off very quickly. We've just managed to extend the battery life to 12 weeks now, which is the length of the time we run the programme for. Just enough to get that behaviour change, create those habits, with a view to them people carrying on with that, and you'll see the results of that in Hounslow and Gdansk. I think in terms of using health arguments, just picking up on what William said, when you are using your messaging, start with the fun and gradually start to bring in the health messages. With Beat Street, we make it all about the fun, and about 2 weeks in, we start talking about how it benefits people's health. But it's not the primary message. The primary message is go out, have fun, enjoy taking part, be part of your community. So really keeping that approach very light to begin with, we know we can engage more people with that. And again, focusing on the benefits independent of weight loss. We get very hooked in health on obesity, and actually physical activity itself is a really important factor. And I think we should stop talking about obesity and start talking more about the benefits of an active lifestyle. It's a much more palatable message for most people, and one that we know is much more effective in getting people engaged. So do think about the messaging that you're using. Keep it light, keep it fun, make it accessible, gradually layer in the health messages. And then in terms of how you use those messages, we've been very successful with social media, with regular media, newspapers and that kind of thing, but also newsletters to the schools, telling them how many miles they've walked, really emphasizing the gamification element, and then those big celebration events. So the game, there's a winner, like any game, so we have a big celebration event whenever there's a winner at a winning school. So using social media to really promote those messages, and then again, gradually starting to talk about the health messages. I'm going to hand over to Mailin for the conclusion. Thank you.
Yes, to sum up and conclude this presentation, first of all, it is very important to have people who take part in the campaign. However, if no After reaching a sufficient amount of people, it is important to maintain and motivate them that they also will stay in the campaign. Therefore, target strategies are helpful to make people interested in your campaign, also to have nice and attractive incentives, to integrate different events on active mobility, then to hand over this well-prepared personalized information package, to include raffles and gamification aspects, but also to make people feel part of your campaign and to provide continuously personal contact. And last but not least, it is very important to have local partners who support you. Therefore, it is necessary to emphasize the personal and institutional benefits of the project, so they are also willing to support you, but also to give a lot of publicity to the current cooperation so that the project is also selling itself, to make for the partners a clear list of tasks, but also to be flexible regarding their needs and to reduce their work to a minimum. And if they can provide information on active mobility, it is helpful to use them on the so-called service sheet, and also to distribute information via their communication channels to get directly into contact with potential participants. Thank you for your attention.